I'm Jaume Costa. I am a medical homeopath. I practice in Ireland, in a town called Trim in County Meath. My background is in medicine and public health, and I studied homeopathy in Paris at the Institut National Homéopathique Français and in London at the Royal London Hospital for Integrated Medicine. After I did trainings in Switzerland with Professor Spinelli, and as well in Barcelona in the Academy Médico Homeopática, and in Asturias in the Homeopathic Academy, and other trainings for congresses of the LMHI and ECH. I got into homeopathy because a member of my family was diagnosed with psoriatic arthritis. He was only 29 and the prognosis was very bad. The consultant said that he was going to end on a wheelchair. We were living in Luxembourg, and we had access to a homeopathic doctor. This doctor was able to stop the progression of the disease, but not to cure. And this doctor one day advised me to study homeopathy. Then I decided to go to Paris and to do the training, and during the training a case very similar was presented, and I gave the remedy of the case. There was a dramatic improvement. I couldn't believe it myself, and now this person is completely recovered. All the symptoms that he had from the psoriatic arthritis, problems walking and pains and all type of discomfort prevented him even walking, have disappeared, and he's been doing the Camino in Spain several times. Yeah, I have a solo practice. I'm very fortunate that I have access to very knowledgeable colleagues, and this gives me support because homeopathy, as in many medical specialties, it's very important to have continuous advancement and support from colleagues to deal with all type of cases. Of course it does, and there is no contradiction. And most of my patients are patients that they have tried first conventional medicine, and they come because they want to have better results. And I advise them to combine both. And of course, when they get better, they decide, and the consultant decides, that there is no need to continue with the conventional or even with the homeopathic treatment. Well, not always. There are patients that come because they want to be treated with homeopathy, and usually what happens is that a member of the family gets better, then they bring other members of the family. I mean, I have now some families that all of them are treated with homeopathy, and at the beginning was only one member. I think what people want is results and see that they get better. Once they get better, they don't care much if it's homeopathy, conventional medicine, or both combined. I had a case of a gentleman over 70 with Parkinson. At the beginning I was not very optimistic because it's a chronic disease, not easy to treat, but he came back with the spouse and he said, "Doctor, I'm very happy, I feel much better, but I want to tell you something. My sexual life has improved a lot." Then I was quite surprised, but of course it was very nice, and I could see a smile on the face of the wife. Well, there are clear cases that conventional treatments should be given immediately in cases of emergency surgeries, but even in these cases, homeopathy can help. And I think in almost all cases, both can be combined. For instance, before surgery, I advise my patients to take arnica, and I ask them as well to repeat it after surgery. And I've seen that this decreases the complications of surgery, the bleeding, the pain, the bruising. Then I think in most cases, both can be combined. Homeopathy is in different situations in different parts of the world. In India, for instance, there are more homeopathic doctors than in the whole of Europe, and is part of care care in the healthcare in India. Yeah. In other countries like Brazil, homeopathy is taught at the university. In Europe, the big challenge that we have now is the number of practitioners. There is more demand than doctors are able to practice homeopathy. And this is a challenge that we have to address as a priority. The research that has been done by several consortiums, they have all pointed out that there is an increasing demand for homeopathic care. This is due to many different reasons. One of them, because even if conventional medicine is very effective in many situations, in some of them there are huge limitations, and people want to try other ways to take care of their health. And of course, for this, we need professionals that are trained, and they are trained in high quality standards, and they are able to deliver. Then, at least in Europe, we have a lack of in number of professionals. We have very good professionals, very well trained, but we don't have enough. The solution is a long-term solution. On one hand, to facilitate access to training through maybe shorter courses and modules, and as well to organize mentorship programs, because as any medical specialty, even if you do a lot of training, after your training you need support to confront the different type of patients. Some of them can be quite complex, and always a colleague with more experience can support you, so that the new practitioner doesn't feel that he's on his or her own and is able to cope with whatever solution. Then the more targeted training with a modular approach and mentorship are part of the solution. The future of homeopathy is that it becomes part of mainstream care, because really there is only one medicine, and it's the medicine that improves the health of patients and citizens. Then we cannot speak about complementary therapies. We have to speak that all therapeutic strategies complement each other, and homeopathy and conventional medicine and other medicines have to work together for the health of the population.